and I'm going to demonstrate a chiropractic examination and adjustment today. This is Putter. He's got a chronic history of some neck issues and some back issues, and you see this a lot with small dogs. They tend to jump off things they shouldn't, such as beds, such as couches. If we were to equilibrate that to our size, it would be like us jumping off our refrigerator, and none of us would think that that's a great thing for our back or any of our joints in our body. The basis of chiropractic exam is to look for places where vertebrae aren't moving normally. So a lot of times you may hear the term the neck was out or rib was out. Bones are not out of place as much as two articulating vertebra, two bones together that are supposed to have a certain amount of motion in them, aren't moving at all. They can either be stuck where they're stuck in neutral or stuck out of neutral, and then our goal with chiropractic is to get that motion back. When you get that motion back, that helps the nervous system function to its ideal level. And so with Putter, what we're going to do is we first go over his back and we feel for any temperature differences. And they should always, whatever patient is here getting a chiropractic exam, should feel comfortable. They shouldn't be stressed. We can't do an adjustment if they're stressed out. And all adjustments are done within the normal range of motion. So injury is not going to be something we'd ever have to worry about as long as a chiropractic adjustment is done properly. So we start back here and we support Putter. And we're going to check his pelvis here. And his left ilium moves perfectly fine. His right ilium moves perfectly fine. We're going to check his sacrum here. It's a little stuck there, and an adjustment is very minimally felt by the patient if it's done properly. Yeah, he's got his apex is up a little bit. So now we come down his back, and we're going to evaluate every vertebral segment. And you can see him react just a little bit here. And this one is stuck a little bit to the, there we go. Okay, that's moving better and he's not reacting anymore. And with this adjustment, as I say, they're very, yeah, there we go. We're gonna check his ribs. Now we're coming up to his neck. And once again, all these things should be, and he's, yeah, and so we're just gonna, there we go. Good, that's moving like it should. Okay, now we're gonna check up here. And the key with this is a lot of times we'll see arthritis in dogs' backs when they get older, and now they're stuck on a lot of pain medications. That's all very preventable if you can keep everything moving like it should. We're always looking for some catastrophic event that caused this issue to occur. It's rarely that. It's not that the dog jumped off the top of the house or did anything to that extreme. It's typically what we call activities of daily living. Dogs do the same thing day after day, and if you're in the same habits, you're more likely to then create the same problems and stresses on the body. When this is moving properly, now the nervous system can function, the cerebral spinal fluid can flow like it should, and all that does is help the whole body remain healthy. And the basis between acupuncture and chiropractic philosophically has one similarity at the very core, and that is the body is innately intelligent. It wants to remain healthy, and if you give it the proper alignment or the proper adjustments, then it can remain healthy. And then your nervous system functions better, you're able to move like you should. But as they say, a lot of these things, if an area of the back gets stuck, then over time other areas have to compensate, and when those compensate, those are the joints where we typically see, because they become more mobile than they should, or what's termed hypermobile, they tend to start to wear out. And here with Putter, how often do we need to repeat this? It really depends on Putter and his activities, but a lot of times Putter gets an adjustment once a month, and that keeps him at the optimal health.